In phase 1, in January, we will have about 300,000 doses of vaccine to administer to the people of Ontario, for those who are eligible and want to have that vaccine, to have it, to give them a greater level of protection than what they now have in those first two priorities, those in long-term care homes, those in retirement homes, those in most vulnerable circumstances, and the healthcare workers themselves. In February, we'll grow that to about 700,000 vaccines, and we'll get at more of the people in those two priorities. In March, we'll go to about 1.1 million vaccines, and so by the end of phase 1, we hope to have vaccinated over 1 million healthcare workers and people in the most vulnerable circumstances here in Ontario. We can't do it any faster. We don't have the vaccines coming to us any faster, and if we did, we would use them more quickly, so we'll do it as fast as we can. And I know it's late to ask for a Christmas gift, but if I could ask for one, I would ask Health Canada to relook the Moderna vaccine and see if we can make that a one-shot vaccine and give us that greater capacity to go out and vaccinate people even faster than we plan on doing it now. We want to flow seamlessly towards the end of March, when we've got more than 1 million people vaccinated across the province, into healthcare workers and those in most vulnerable circumstances. We want to flow seamlessly into what we call phase 2, and that's when we get a large number of vaccines that will flow to the province of Ontario. We're looking at 15 million vaccines flowing into Ontario during the months of April, May, and June. And while we do not know exactly when they'll come, we're assuming that we'll get them at 5 million doses of vaccine per month for April, May, and June. And therefore, as a result of that, we want to be ready to put needles into the arms of about 150,000 people across Ontario per day. For that, we want to use mass vaccination sites, and we'll want to get several of those up and running to ensure that they are ready to go in late February, early March, to ensure that they are ready to go. We'll want to continue to use the hospitals, although we may not depend quite as heavily on them because they are fully occupied, we know, in the war against COVID on the other front, and we know that the stresses and strains on them are great, but also we want them in the fight nonetheless, and they do want to be part of this positive part in the fight against COVID-19. And we want to use a vast number of vaccination sites, and dare I say it, pharmacies across Ontario, and we want to use special mobile vaccination sites that can go into areas or go into folks that are at high risk into the area where they are and actually vaccinate on site. And the prioritization has not been done for phase 2 or phase 3 yet, and we will offer some counsel to the Premier and to the Cabinet and therefore to the Government of Ontario so they can tell us what they want to do first. But I actually think with the number of vaccines that we have coming in, we will very quickly be able to get a number of priorities, and we'll be able to get into looking after many of the essential workers across Ontario, whether that's farm workers or police officers or school teachers or other folks. We will be able to start, I believe, starting to vaccinate them early in that phase 2. And we will be able to get at people at various age groups, particularly those who are most vulnerable, that we did not pick up in the long-term care homes or the retirement homes. That is to say, people that are 75 and upwards, people that are 50 to 75, and we will be able to start with those age brackets, and I think maybe the pharmacies would be a good way of executing that part of our program. We'll be able to start with those age brackets, and at the same time, we will be able to really pay attention to those in most vulnerable circumstances. Some of our First Nations in urban settings, for example, other communities that are close unto themselves and don't normally seek medical assistance and live sometimes, frankly, off the grid. We will want to be able to go into some of those neighborhoods and some of those communities and vaccinate where they are and offer them this opportunity to be protected from COVID-19. We want to roll through April, May, and June and use every single one of those 15 million vaccinations. And if you do the calculation, you'll realize that's about 7.5 million people, thereabouts. More if Moderna should be a one-shot vaccine. If you add that to the over 1 million people that we will be able to vaccinate in phase 1, we're going to be at 8.5 million people in Ontario vaccinated by the end of June or early July. That's the bulk of Ontarians who we believe are both eligible to take the vaccine and who will want to take the vaccine.